And that's you live, thank you.
Well, good morning, everybody, and welcome. I'd like to welcome the board members and advisors to our first Community Partnership Planning Board meeting of 2026. For those of you who haven't met me before, I'm Mark Cook. I'm the chair of the Health Board, and I wasn't here for the last meeting. So approving the minutes, when we get to that, I will have to defer to people who were actually there. But it's great to see you all in person, and welcome to all those joining online. Hope you can all hear us clearly. Can you give us a wave if you can? Yeah, excellent, wonderful. There's been some board member changes since the last meeting with James Ferguson and Sue Parry as our new Community Council representatives. Unfortunately, Sue can't join us today as she's on holiday. Joe Shearer is now chair of Third Sector Dumfries and Galloway and will take up one place that's allocated to the Third Sector, and Helen Kerran will make up the other place as chair of the Third Sector's Leaders Forum. We'd love to thank the outgoing chair of Third Sector Dumfries and Galloway, John Dugan, for his positive contributions to the partnership and community planning over the last few years. Could I just take the opportunity to remind everybody that we're being live streamed today to allow public access, and also that the meeting is being recorded and will be available for subsequent viewing online. Just before I pass to Stephen for the apologies, I would just like to note that Julie White, who would normally be here today with me, is unable to attend. However, we do have Dr. Ken Donaldson, who is the Medical Director and the Deputy CEO, joining us, along with Valerie White, Director of Public Health. Stephen, could you tell us about anybody else, please?
Thank you, Chair. Apologies from Jane Morrison-Ross, and Rob Davidson is our substitute online, and we'll also have Russell Griggs, who's online also. But I know Russell needs to leave around 11:30 today. And the only other formal apology received is from Councillor Gail McGregor. Thank you.
Thanks, Stephen. So if I can move us on to the first substantive item, which is the draft minute of the 3rd of October meeting, which I hope you've had a chance to review. Could I open it to the room and online? Are you all happy that this is an accurate record, or are there any corrections or omissions that anybody would like to make? No. Okay. Approved. Perfect. We will record that as approved. So the next item is the Community Planning Action Log, and Stephen, you'll take us through this. Thank you.
Thank you, Chair. Everything is on track or complete or being integrated into longer term implementation plans, but just a few things to bring to board members' attention. Just on number 1, and it's on page 14, there was an action linked to the Youth Council item to meet the Student President and Vice President of the College Student Association, and the lead officers asked if I could raise that he's waiting for a few partners to nominate their rep for attending that one before a meeting can be agreed. So if you can have a look at that through your respective organisations, that would be helpful. At number 4, it was also obviously a very successful launch of the physical activity strategy a couple of weeks ago, which was great to see. At item 6, our employability colleagues have just provided some updates on the ASN in Schools project, and again that's going to be integrated into normal business of our employability team. Number 8, in terms of the locality plan, we've now got leads for all the actions within the locality plan, and the leadership team is looking to collate initial progress updates for the March meeting. And on a similar basis, the action around place planning, the chair of the place planning partnership has been reviewing the membership and looking to how we can strengthen that, and the leadership team's considering that on the 6th of March, and we can provide an update to the board meeting on the 13th of March following that. And just the final one, number 10, in terms of outcome-based accountability linked to the LOIP and our performance reporting, which we're constantly looking to review and improve. And the Deputy Chief Exec from Third Sector, Dumfries and Galloway, has kindly taken a lead on that and has produced some excellent work and is working with the leadership team to work through the detail on that. So that's all for the action log. Thank you, Chair.
Thanks, Stephen. So if we move on to item 3, which is the main item, or one of the main items, which is the population health framework and the particular priority of healthy weight management. Now, Valerie White's going to lead the discussion for this session, and she's going to be ably assisted by some facilitators from D&G, who she will be able to introduce in due course. We will be standing down the live stream for part of this meeting so that the breakout rooms can work effectively, but it will be restarted at about 11:35 when we all return. So with that in mind, I'll pass over to you, Valerie, for the details.
Better put my mic on here, although I'm not sure that I need it in this room. I've got a couple of colleagues who are going to assist me today. So Christopher Allen, who's consultant in public health, and Shona McCoy, who's the local authority lead for the local development plan. So I'll just ask them to come to the table. I've also got online Christopher Topping, who is a public health improvement lead for physical activity, Ethne Clark, who's the infant feeding coordinator, and Kimberly McLean Guthrie, who is our programme lead for our Healthy Child programme. So there's been numerous colleagues that have helped support and pull together the presentation today, so we will be speaking to them in the session as well. So just really to give a bit of context to today, so as colleagues are aware, we agreed that we would take a thematic approach to the Community Planning Partnership meetings. We had our conversation about place at our October meeting, where we decided to do health and wellbeing today, and we're going to look at poverty and inequality at our next meeting as well. So healthy environment is a priority 2 of the population health framework. And as was outlined in the paper that accompanied the papers for today, this is what we're hoping to cover today. And at the end of today, to go, what do we actually want to do to get some direction from the board? What do we actually want to do in this space over the coming year? So no pressure, everybody. That's what we want it to come as an outcome. But what I want to do is just connect this to our local outcome improvement plan, because as community planning partners, this is what we are here to deliver. And as you'll see in terms of our vision, health and a healthy population is absolutely key to our vision. And we want to enable our population to be as healthy as possible. And we've got our key priorities there, which we've set out. And I think as we kind of go through this presentation today, what we'll come to is all of this is all interconnected. They all interconnect together. Health and well-being really connected to poverty and inequality. It's connected to work. It's connected to our communities and where we work. So all kind of intertwines. When we get to the community planning level, everything becomes really, really complex, doesn't it? So we'll have to recognise those connections. And I suppose what I want to do as well is ground us in health, because our health is just so important to us. When we have changes in our health, we know the impact that has for us as individuals, or for our family, for our communities as well. If we've got a healthier population, we can have stronger communities. It contributes to our economic development. We've all got organisations that we sit round this table and that we run, and that relies on our staff being as healthy as they can be to contribute to that. And we all know that our services are all under extreme pressure right now. And if we can create the conditions that enable people to be healthier, then that reduces the demand on our services as well. So when we talk about weight, it can be a very polarising conversation. It can be a very, very sensitive issue as well. And so this little video that we're going to play just now is probably going to say in under 2 minutes what it might take me 40 slides to do, and I don't want to put you all through that. But it really is getting to the heart of actually what is it that we need to tackle when we're talking about a healthy weight environment. It's part of a set of videos and materials that Public Health Scotland have produced called the Challenging Weight Stigma Hub. And I would actually really commend that as something for people to have a look at in terms of this issue, because it is quite thought-provoking. So if I can just ask Sandy to play the video, and we have tested it, so fingers crossed it does work okay.
Too often, the discussions about weight are heard as stigmatising and laying blame on individuals for their weight. The notion that a person's weight is solely a matter of personal choice, easily reversed by simply eating less and exercising more, belies a more complex story. The research is increasingly clear that a multitude of factors affects individuals' weight and their ability to manage it. These include genetic factors, life circumstances, income, psychological factors, other health issues, including mental health conditions, and access, or lack of it, to non-stigmatizing treatment and support. In particular, one of the central factors influencing our daily lives is the environment in which we live, play, go to school, and work, including the kind of food marketing and advertising we're exposed to. Taken together, these elements shape our behaviours and can hinder or support how well we eat, how active we are, and, in turn, our ability to manage a healthy weight. Substantial shifts in population weight over decades is not because people today have less willpower or no longer care about being a healthy weight, but because obesity is a normal response to this abnormal environment. Yet, this research is often ignored in favour of more simplistic explanations, reinforcing negative stereotypes about people with higher weight as being lazy and irresponsible, and fostering weight stigma.
So some quite challenging things in that video there, and I think helps to kind of reset how we have conversations actually about weight. So I'm just going to go over what the data actually tells us about this, and I think probably what I do want to highlight is that this is not just a challenge in Dumfries and Galloway, it is a challenge in Scotland, it is a challenge in the UK, and it is a challenge across the Western world. But 72% of our population are estimated as living with being overweight and obese. And we've got that level of populations. That's not individual choices. That's more about how have we created conditions that have led to that. 27% of primary 1 children are at risk of being overweight or obese. That's over a quarter of children in our region. 60% of expectant mothers also experience an unhealthy weight, and the figures are on the screen there for the percentage with overweight, which is 30%, and 29% with obesity. And obviously that can be very challenging for mums themselves, can put them at higher health risks during that pregnancy, but also for the baby as well. 7% of the total burden of disease is estimated to be over higher BMI. I actually thought that figure would be much higher than that. But we know if you're living with a higher BMI, then it does increase your risk of cardiovascular disease, certain cancers, and development of diabetes as well. Dumfries and Galloway has also the highest rate of new cases of type 1 and type 2 diabetes amongst all NHS mainland boards. Now, of course, we have an ageing population which contributes to that, but being of a higher weight it significantly increases your risk of developing diabetes. We know how connected poverty and health is. Children who live in lower income communities are twice as likely to experience being obese as children from more affluent communities. So we know that poverty connection is really, really strong. We also know that for lower income families, they are spending a significantly higher proportion of their disposable income on food. And Dumfries and Galloway Citizens Advice Bureau did an excellent report about the cost of living in Dumfries and Galloway, which was really clear that access and costs of healthy food vary quite significantly across our region. Obesity is projected to increase quite significantly in Scotland if we don't do anything to intervene. And the cost of that in terms of Scotland is estimated at £53 billion within the economy. And that's an annual cost. That was Nesta that estimated that. And I think it's about 772 million of that is like provision of NHS services. So we are spending huge amounts of money in terms of trying to treat this challenge. So I said at the start of this that when it gets to the community planning level, it gets quite complex, and there's no easy answers to this. So the diagram on the left-hand side is from the Foresight report, the obesity report, which was written nearly 20 years ago now. And it really started to map out how complex the food environment is. And it was really kind of the first report that was saying that the biological factors, the social and cultural factors, the levels of physical activity that we have in the region, our dietary patterns, and our food environment all are interconnecting hugely to create this real area of challenge. And when things get really complicated, it's really easy to go, let's pick on the easy thing. Let's say it's all about lifestyles. Let's say it's all about what people are choosing to do. And we focus on the top of that iceberg. And we don't get to go, no, actually, it's all interconnected. It's about our living conditions. It's about the educational attainment people can achieve. It's not just about educating people to look better. It's connected to our housing environment and our open spaces. It's all really interconnected, and that's why it's important from a community planning perspective that we do have these priority areas looking at poverty, looking at work, looking at our places, because these are all absolutely interconnected. And when it gets to the community planning level, that's where we sitting around here as leaders need to go, what are we going to do in our spaces to look to make some changes to support our population? So in terms of the population health framework, so priority, so it was published in June 2025 with two key priority areas. One was about a preventive focus system. How do we shift what we do to that prevention space? The second priority was about a healthy weight environment, recognising the challenge that we have in Scotland in relation to this. And a real recognition that, yes, government need to take action in this, there needs to be cross-government action in relation to this, but there also needs to be that action and that leadership at the local level as well. So colleagues around the table may be aware of the legislation in terms of high fat, sugar, salt, which has been brought into force. So there's now restrictions on advertising, but take note, online, on television, and we'll come to outside marketing later on in the presentation, but that's coming into force before the watershed. Later on in the year, there's going to be the price promotion legislation that's going to come through, that's about kind of the price promotion of healthy products. So government are taking action in this space and are looking at developing a diet and healthy weight action plan. So I suppose what I'm really keen that we think about today is we don't other this in this meeting, that we don't go, oh, it's the national government that should take action. We've got action that's happening there. This is really what's in our sphere of influence and what's in our control for us to look at. And I really want us to focus on the prevention. It's easy to say, oh, we can treat this, but actually we know how significantly under pressure the health services are. We need to really move into that prevention space. So, I've probably thrown quite a lot of information at everybody just now, and I will just check my timing and we're okay timing wise. So I was proposing that we kind of paused just for 10 minutes or so, just to take any initial reflections or thoughts that anyone wants to have before we move on to what have we done so far about this, and what can we do going forward. So I don't, Sandy, if you could maybe take that slide down just so that we can join online in terms of any questions. So I'll open it up for any questions and reflections from the board. John.
Yeah, thanks. Thanks for the presentation. It was astonishing to see that percentage for primary ones at risk. It's quite a high number, but I take it that's right across the whole region of Dumfries and Galloway. I'm just wondering, is there sort of like pockets or areas where it's a greater risk, you know, for example, the main towns, Dumfries, Stranraer, Annan, etc.?
What we do know at a Scottish level is that absolutely there's patterning in terms of lower income areas. Now in Dumfries and Galloway we have, you know, challenges in terms of our poverty can be quite dispersed. So I'm just going to check on the call with my colleague Kimberly Guthrie to see, Kimberly, in terms of that data, if we've got it drilled down to that lower level and if there's any patterns that we can see. So if I can ask you to come in, Kimberly, that would be great.
Hi everyone, thanks for bringing me in. Yes, so Public Health Scotland are able to look at it based on intermediate zones. So yes, which highlights which areas in the region. So for this last year, I don't have the data as of yet, but yeah, there is some variety there. They have also just updated their dashboard, which further looks into areas. So we're not able to put it into specific schools for primary one due to some schools having low numbers and potentially being identifiable, but that wider kind of intermediate zone area, we are able to pocket that. So I have requested that from Public Health Scotland, and hopefully when their analytics been able to bring that together, I can provide that further information.
No, thanks very much. Appreciate that.
So I think what we can certainly do is take that as an action to share with the board once we actually have it as well. I think I just want to re-emphasise that key point of this is about conditions that people and families experiencing, because I really want to be really clear that this is so complex, and I really want to avoid any stigmatising or blame being on individuals in relation to this, because it's a really challenging aspect. Dawn.
Morning Valerie, and thank you for the presentation, and I'm sorry I'm not there in person today. I'm just interested in, you know, creating the conditions and the environment for healthy weight, and obviously this, you've referred to this being an issue across Scotland, across the UK, across the Western world, and I'm just wondering, maybe this is something that we'll come to during the course of the morning, is, you know, where are there examples of other places that other nations, other, you know, in communities where this has been, you know, a real area of focus, but they've brought in, you know, new measures, new thinking around how to create that environment, and what is it about other parts of the world that, you know, and I think we all have our own understanding of that, but what is it about other parts of the world that means this is not such an issue? So just interested in those wider comparisons, Valerie. Thank you.
Thanks, Dawn. And I think we will come on to, in terms of like what the evidence tells us in terms of what can work. I think you're right, Dawn. Though it is a challenge of you know, the Western society as well. But I think what we shouldn't do is, it's such an overwhelming problem that we can't do anything about it, because I absolutely believe that we can do that. But we will come to that, Dawn, in the kind of second half of the presentation. Thanks. Russell.
Excuse me. Good morning. I'm speaking now not as chair of South of Scotland Enterprise, but as chair of the group that advises the Scottish Government on the implementation of regulation. And one of some of the areas we've been looking at closely recently are the implementation of all the stuff around food and fats and vapes and everything, because and it's fine. So there's no negativity in it. However, what we've been looking at is the impact all of this has on small retail shops, especially in rural areas, who rely on a lot of the profit they get from a lot of those things to go forward. It's not, so nobody's saying it's not going to happen, but we all must be aware, and it's the point that Mark made at the beginning, of the economic impact. So on one hand, we're trying to make our population more healthy, which is super, but on the other hand, it will have an impact on small retailers and how they can do it, how they can advertise, what goods they can do, and that inevitably will have an impact on their profitability. And we all know that one of the things we've talked about in this forum before is about our desire not to decimate the high streets of rural Scotland.
No, thanks, Russell. And I think that's always a challenge that you have when you have complexity, is you're balancing competing priorities. There's different perspectives and different views. And I think it's choices that we make as leaders in, you know, our local environment, and it doesn't always have to be in a negative way, that things can be changed, as we'll maybe come on and look at later. But absolutely understand that point. But I suppose that's the challenge here. What actually do we want to do in terms of those environmental conditions to support our population to be healthy? And I think I've been very clear on my position, and as the board has, in terms of the promotion and marketing of vaping to children and young people. But yeah, appreciate absolutely, Russell, the point. Sorry, Russell, do you want to come back in?
No, yeah, I was just saying I'm not against it, so I understand exactly what you're saying. So, but it is just to say that it's a cumulative impact of all this stuff. So it's not just the food, it's the vapes, etc., etc. So all the good stuff we're doing, which I'm for, so I'm not against it at all. We just have to realise the economic consequences that could have.
Yeah, and Andrea.
Thanks, Valerie, and thanks for the presentation. I had a similar question to my colleague around the evidence around like place level, so healthy weight environment, place level. But what I was quite interested in was the forecasted increase in women compared to men, and just whether there's any further insight in that. I can't remember what the figures were, but 17% increase forecasted for women compared to much less for men, and if there was any further insight into that.
Now you've asked a really hard question for me, Andrea, today. I think there's some biological differences between men and women. I would actually need to go back and just examine, you know, what some of those real kind of factors would be. But that's certainly something that we could look into. But I think that it is that is the predictions that that there is at the moment. But absolutely can take away an action to go and look into that a wee bit further to see if what does that mean in terms of the kind of intervention level. I think it's probably still the same generic kind of high level interventions that we need to take, but happy to go and have a look into that as well. Any other oh gosh, a few. So we've got Stephen and then Alan, and then we'll maybe move on to the next part if that's okay. So Stephen.
Yeah, thanks, Valerie. So it's a few sort of observations, but so community planning partnership boards have been around since 2003, and I think that was just quickly, co-pilot, whatever. So there's been an increase in obesity since then and before then, and the biggest rise was between 1997 and 2008 or something like that, and it's increased pretty much, plateaued, increased all the rest up to 30, whatever the figure is now. So has the existence of community planning partnerships and that kind of Lloyd type model slowed down what could be worse, or has it made any difference whatsoever? So that's just a genuine question. And the other thing is, the video talked about biology being a factor. I appreciate there's going to be this multifactorial sort of thing, but how much? So I'm curious, has there been a change in our biology in the last 30 years? So that's I know all these things are factors, but it tends to be the biology is not really going to change, but all the other things in our lives maybe do have an impact because of the biology sort of framework that we operate on. And the other thing is that other countries that have been successful in sort of having a impact on this it seems to be at the legislative and national level in terms of advertising, sports sponsorship, sugar reduction in sort of foods, really strict food standard stuff. So locally we don't really have that much control of that here, but certainly at national and UK level we could do that. But then I'm just thinking about streaming services where a lot of young people are getting information and content. How do you have that territorial control over streaming services like that that's not maybe through sort of standard things, because that's where a lot of people get stuff. So there's a few things there. Maybe we can't answer them today, but yeah, it's just that, you know, I don't know how much we can control and what have we been doing so far that hasn't worked, or what have we, how much have we slowed things down.
So in terms of as our biology changed, our environment has changed and our biology is not able to catch up with the changes. So actually what we've done is we've put ourselves in an environment that's incredibly challenging, and that means that it kind of interacts with kind of biological and genetic factors. For some people it's more impactful than others. So it's more about how we've evolved, hasn't evolved fast enough to cope with the changes in our environment. Has community planning made a difference? I'm not aware that we've had this conversation about the healthy weight environment, or, you know, within community planning. And I think when we go on to have a conversation, I'm going to specifically talk about, well, what are some of the local levers that we can do in relation to this? Because you're right, some changes are, as I said in the presentation, required at that national level, which is being taken forward. I think what our role is, but actually in that context, what can we do here? And we will come on to that just shortly, Stephen. Alan.
Yeah, thanks again for the presentation. I suppose a couple of reflections from the questions that have been asked already, particularly around John's question about the data on place and where that sits, and I suppose it just puts me in that I suppose position around whatever we do and whatever we go on to talk about, perhaps we need to keep in mind that it's a place-based and community-level response we need, rather than a region-wide blanket response, which tends to be what happens around policy, that we have a education policy, for example, and all schools do a thing, and actually we're not necessarily responding to the individual environments, the local environments that people are living in. And I suppose the second point, you did mention the DAGCAS research, which I think is really helpful, and I think just demonstrates on very practical evidence about going round to do the shopping of a basket of food, the variance between the cheapest and most expensive basket of food there was over 120%. So this idea that it's choice, that I can actually just go and choose to shop somewhere else, is not real life in rural communities like Dumfries and Galloway. So I think that points to some of the questions that Russell has as well around this idea of we want to promote, and actually rural areas thrive on really strong local economies, and therefore I think we need to be minded about a local response and not a programme response, if you like, which comes out in some of the other themes, which may or may not, to Stephen's point, be having that impact. The kind of last point, I guess I'm thoughtful as well, just on Stephen's question, is today for me is most helpful about exploring together whether we are doing all the things that we can do, as opposed to some of the national things that may or may not be happening that we actually necessarily don't have an influence. I'm like you, I'm not as convinced that historically community planning's taken hold of some of these really big kind of community lifestyle issues necessarily, and I think this is a great opportunity for us to try to do that. Thanks.
Thanks very much, everybody. So I'm going to move on. I'm afraid you're going to be stuck. If we could put the presentation back up, Sandy, that'd be brilliant. I'm going to speak for a wee bit longer, and then I'll be bringing in my colleagues to join me as well. So I'm going to talk a little bit about, well, kind of what have we done about some of this, and how can we learn from that. So in 2024, there was some work done. It was led by Kimberly McLean-Guthrie, who spoke earlier, working with an expert called Dr. Nick Cavell, looking at a whole systems approach to diet and healthy weight in the early years. So this brought together a number of individuals from sectors across Dumfries and Galloway to talk about this, to exactly do some of that mapping of what was happening, and to look at the gaps in terms of where have we got things that are missing. And so what that demonstrated was there was a lot of really, really good stuff happening at that community level, at that practitioner level. But what tended to come forward in terms of the actions were those actions that those practitioners felt they had control over and that they could actually influence. So it was that kind of stuff about a capacity building, looking at gaps in terms of kind of cookery course provisions. It was those kind of community-based things that they were actually looking at. And when it came to, you'll have seen in the papers referred to the 7 local levers, when it came to some of those really big things, they felt that they couldn't really progress that. So you can see in the screen some of the things that were kind of recommended, but that was really out with kind of the kind of sphere of influence and control of those practitioners. You know, they are great at building the connections, looking at opportunities and getting on and doing that. But actually some of those things about those environmental shifts and the asks from that have been a challenge to progress. So I can give you an example of one of the things that came out of that was Healthy Movers programme. So that was delivered in partnership with Active Communities and the Youth Sports Trust, and they came together. The Youth Sports Trust delivered training to 40 nurseries across the region, and this was about kind of increasing that kind of physical activity literacy among practitioners, so that that could be passed on to children and young people. There have been further involvement from community learning and development and education to kind of embed some of that knowledge and skills training. And also that's going to be taken forward with parents and communities and members and looking at kind of intergenerational approaches. So that was one of the really positive examples of partnership work, and that they just got on and did that. They don't need us to tell them to do that. They did that as well. There's also been the further rollout of Henry training, which is a training programme that's been delivered to multi-agency partners to support those kind of conversations about diet and healthy weight in the early years, and also infant feeding training as well. So that mapping exercise gained a lot of great connections. I think Shona, your team were very involved in that, brought together loads of people, increased everyone's knowledge and skills about this, and they went on and did loads of things at that level that they have got that influence in. But it was those kind of things about the more environmental things which sit with us around this table that was a challenge. And I was just going to say, in terms of the last one there, we do know that there's a lot of work that goes on already in terms of our Poverty and Inequality Partnership to increase family payments uptakes as well. So that is ongoing. So where are we now? And this is a kind of NHS kind of focused slide in terms of what is delivered, but much of that is actually delivered in partnership with a range of partners across the region. I will touch on the services that are provided by the NHS. You can see there is a range of services that are there, but they do have criteria that people need to meet. The demand for those services has increased in recent years, and it is a challenge to keep up with the level of demand. But as I've said in this conversation, absolutely accepting that accessible and non-stigmatising weight management services are really a key part of a whole systems approach. I want today to really focus on that prevention rather than the treatment aspect of things. So as you can see, there is an awful lot that we do and that we do well across Dumfries and Galloway. And I know there's great work that goes on in terms of our third sector, in terms of that community food provision, work that goes on in terms of promoting allotment use and community growing. So lots and lots of things that go on in a range of partners as well. So Chris is going to talk a wee bit later on about the physical activity strategy, which the Community Planning Board has approved, and as senior leadership team, we've committed to support the team that are taking this forward. But this is this whole systems approach to this, and this is looking at those 8 subsystems there, which is about more creating those conditions and those environments, and everybody here has a role to support in that. So increasing physical activity, and as I promised Chris, I would highlight that muscle strengthening activity as well, which is really critically important. And I think it's really, really important that we do see physical activity as a really, really important means of a healthy weight, but it is not the only part of the puzzle. We do have to work on the food environment. So I am now going to stop talking, and I'm going to hand over to various colleagues, but I will still be in control of the clicker, so they can tell me when to move on to the next slide. So I'm going to hand over to Chris Allen, and I'll put my mic off, Chris, and I'll put yours on.
Thank you very much, Valerie. So what does a healthy weight environment look like? Well, I think you'll recognise much of this model from the work you've been involved in before, and I think the answer is it's pretty much the same as an environment that promotes and sustains health as a whole, and generally with some key underlying elements as outlined in this slide. The main things this model speaks to me about how we create structures that, as far as possible, promote and enable a safe and autonomous movement of individuals within the environment, and promote the production and consumption of a healthily balanced diet, and how we build this into the planning and processes and decisions that we make. So then this whole model leads on to what local levels we might have, and what action we can take at the local level to promote such environments. So this is a list of local levels and actions that's drawn from evidence published by Public Health Scotland, and the Scottish Directors of Public Health, the University of Edinburgh, and Obesity Action Scotland. And in a while we're going to consider these briefly in turn before we move out into breakout discussions. But I think the key thing that's already been mentioned to address is poverty in general, particularly child poverty. So the choices that people make and the options that they take are affordable to themselves. So setting that aside, there's clearly action to take in a number of different levels, and it's already been repeated a number of times. That's a whole system approach that's required to the multifactorial issue. So this slide's just to give you some pause for thought that you can maybe reflect on in the group discussions later on. Do you think the conversation's moved on over time? Do you think it's moved on from stigmatising individuals and putting individual responsibility to people to manage their own weight in the environment that's constantly changing? Do we see weight stigma and discrimination in our organisations? Do we witness it? How do we challenge it, or do we challenge it? And have we been participants in it, whether implicitly or otherwise? I don't know if anyone wants to come back on that, or just let it permeate for a bit, and then we'll come back to it later.
I have a general question which I stuck my hand up about, if I may. And it's about, and all the recommendations and advice have been given to government over all this stuff around this has been very positive, etc. However, and it's a big however, is we need to make sure it's joined up across everything we do. So there'll be other parts of Dumfries and Galloway Council looking at town centres, and there'll be others that can, and one of the things that town centres are, if you bring people back into them, what do? They open more cafes, they open more restaurants, they open more fast food shops. Where to do that? The next community up from me in Sandkirk or Connell are going to use the wind farm money to reopen the fish and chip shop. So it's about, if we're going to do this, how do we put the marker across everything that we do so that you guys don't go off and do all sorts of really good stuff, but other parts of other organisations, or indeed the same organisation, are off doing things that, through no fault of their own, may not give you the same result. And there are ways of doing both, but unless you sort of try to join it all together, it will be a challenge. And the fish and chip shop in Kelholm is the one that's bothered me greatly recently for all sorts of reasons. But we are, as a public sector, trying to do about 3 things at once all the time. So we want to make our people more healthy, which is absolutely super, but we want to make the economy in our town centres more stable. That means bringing more people back into them to live. But to do that, you've then got to open more restaurants, cafes, and people to do that. And that's fine if they produce healthy food. And Rob, at some point during the morning, will show you the stuff we're doing with my associate hat on around nutritional food. But it is about how we embed this across everything that we do, because if we're not, you'll be fighting each other. You'll be doing one on one hand and the other one will be doing something different, or you've got the propensity to do that.
Thanks very much, Russ. I suppose if I can just come in. So round the table are the leaders of the organisations in Dumfries and Galloway. So actually, it's our roles to try and join all of this up. When we get to community planning, it gets hard. And it is, and you say, Russell, there are competing, priorities. We'll come on. We talk to Good Food Nation about kind of engagement with communities, but there's communities to bring on board with some of this as well. So if we around the table can't start to join some of this up, then who is going to? So sorry, Mark.
No, thank you. And I just wanted to apologise to Russell and to people online. When it's full screen for slides, we can't see anybody putting their hands up. So it wasn't that we were ignoring, but as chair, I wasn't aware. So thank you for jumping in there, because otherwise we wouldn't have known.
Oh, sorry.
It's okay just to come in, yeah. Thank you. So, kind of on the back of Russell's point, I think the coordination's the key thing. So, I'm sort of imagining a coracle in a tsunami sort of thing. So you could control various things locally, but if it's not joined up in the bigger environment that's buffeting you around, it's going to have a limited impact. And there's a danger that if we don't properly diagnose the problem, we'll waste a lot of time and resources trying solutions that don't actually work. But
so this is what we're going to go through.
Yeah, no, I get that.
These are actions that have got an evidence base.
Sure.
And they can be actions that can be explored at a local level.
Yes. So and I'm glad that that's what we're going to do, but it's just a point to make. But the other thing is economy. When it comes to economy and planning, this is where it's sort of often a bit sticky. So we have a sort of collective span of control, if you like, as public sector bodies. And our planning framework, and I'm sure Sean will probably keep me right, maybe, but we have to, if we get an application for McDonald's, it doesn't matter what we say here, the planning process will determine whether or not that goes ahead, right? So then you're back to, well, what does National Planning Framework 4 say? So you're back to national framework setting, if you like. So I think that's something that we have to. We can say nice stuff about planning now, but yeah, okay.
We're going to pick that on, Stephen, so it will be.
Okay, and in terms of the fish and chip shop in Kellerholm, now I don't know much about economy, but it generally seems to be that the stuff that people want the most, they buy the most of, depending on the climate at the time. So if you put 2 different fish and chip shop and a health food shop next to each other, I don't know which one would be more successful, but you could say, well, the market will decide, arguably. Yeah. And the things, while we might message and promote and encourage and set all the right values, that doesn't always translate into individual consumer behaviour. So there is something there about how much of that is controlled by the private economy and what people choose to set up as a business, which we can influence and message to, but ultimately it'll be a business decision that determines whether something works for a while or not. So it's just to chuck that in there, but I'm sure you're going to cover it all. But thank you.
But might not cover quite it all, Stephen. But I think we will pick up some of those points as we're going through.
Thank you. So I think this has already been covered a little bit by what Valerie said and some of the concerns that have been raised online and around the table as well. But the government can do some things, but how do we focus on what we do locally and in a locally sensitive way that's sensitive to communities and individuals? So the UK governments have recognised, that product placement and promotion is a factor on how people make choices, especially in young people's minds. Hence, they're setting a watershed on when the advertising takes place. So the existing restrictions from this year apply to TV and online only. And the regulations only apply to businesses with 250 or more employees. And further regulations come into effect in October this year, restricting the promotion of such products on premises. And this will apply to businesses with 50 or more employees. I think that Stephen, who said before, is this a significant issue for Dumfries and Galloway? Do we harness much control over local advertising? Where is it? And we'll come to that later in further discussions. So I think I'm passing over to Shona now to talk about.
If I can just come in terms of this slide, because I think this is going to be becoming more important, because as there are restrictions that are put on advertising for kind of TV and media, the local advertising and local marketing is going to be a bigger market, and we know that as public sector we are struggling, from financial perspectives, and so actually organisations may well be looking to go, how can we increase revenue? Can we look at, have we got advertising space that we can sell? I'm not sure if the council already do have advertising space that they let out to third-party contractors, because the evidence is really strong that if you've got a high concentration of local of marketing of products that are high in sugar, fat and salt, and that influences what people actually kind of buy. So I suppose the question is there something in this from a local perspective that we need to think about in terms of what advertising we enable and we support within our remit? Sorry, Douglas.
I suppose from a college perspective, we work predominantly with 16 to 24-year-olds. And it was the point you were making around, social media and, television. Television is not watched. Social media is, predominantly the thing that young people focus on. What we've actually picked up is it's not advertising, it's influencers. And I think that is one of the most fundamental things. We actually have young people in our college population who are influencers, who are actually sponsored by the sugary drinks companies to actually promote them, and they turn out a TikTok video no matter what situation they're in. It's actually one of the most fascinating things once we started to pick it up, and it also it extends even to influencing careers, because it is seen as something legitimate. And I wondered, is that how companies are now coming round, that what they're doing is they're picking up people with large followings and they're utilising that, because it's definitely, without doubt on the rise, within college.
And I suppose just in terms of that the online market is a big one. The level of control that we have on that is difficult, but what we do have control over is the local advertising space that's within the control of the council, the NHS, so it's what, again, it's like that focus on, so do we have policies about this? Do we have advertising policies? What restrictions do we put in? So that, again, that's what that it's that focus on what can we do, because what we don't want to do is amplify and make it worse. The local levers report, which is in, the link to it is in your pack, looked at advertising that was put out, and it did a trial of like reducing some of the advertising, high fat, sugar and salt for people, and it did have an influence on consumers. Now those were in urban areas, but there is an impact of the advertising that you're exposed to, that you do walk past. So it's what can we do locally to kind of shift that dial. So conscious I've just spoken all over.
Just come in briefly on Douglas's point though, because I think it's fascinating. I've got 2 daughters in that kind of age range, and they're always on their phones, and that's where they get most of their information. So is there something about us trying to actually get an influencer to do the right messaging? You know, to go out and speak about healthy eating and speak about not having sugary drinks, and obviously it's going to cost, but just a thought.
Well, we can write that down on the list of suggestions. So.
Okay, yeah, thanks. So, thanks, Stephen, for setting that up quite nicely. It sort of ties back to the earlier slide, I think, that Chris covered round about the 6 elements of place, and the involvement of the development planning team, local development plan, to me just really embodies this whole place principle, and what Valerie's been speaking about that kind of local impact. As Stephen rightly said, then I appreciate there's a lot of text up on that screen, but it was just to show really and demonstrate from the planning perspective, the land use planning perspective, that we are now governed really by what's set out in that National Planning Framework, which is the Scottish Government's policy document about land use planning in Scotland. So our local development plan really has to reflect what's in that National Planning Framework, unless we have really strong evidence locally that we want to deviate from what is in that strategy, that framework. So really, you'll probably all be very much aware as well that Scottish Government, this is a big push for them, kind of healthier places, better places to live, and they've really linked that the whole way through the National Planning Framework, through their 3 themes of sustainable places, livable places and productive places. But it's really strong through the livable place theme. And again, I have to say, there's a complicated diagram at the beginning, but it very much links it to other strategies that are out there in that framework, which for me, again, just embodies that whole collective, collaborative working, and particularly the place principle, that everybody has a role to play in delivering this. So on that slide there, I just tried to pull out sort of the 3 main policy principles that we would be looking to reflect in the local development plan, which I think we're currently doing in Local Development Plan 2, which is the current local plan for Dumfries and Galloway. The relationship to access, particularly to open space, to play areas, to nature, networks, green networks, how accessible they are for people to exercise. Policies in there about food growing and allotments. There is the one in there about drive-through facilities, and we have had a couple of live applications for McDonald's in both Dumfries and Stranraer. But I think a number of local authorities in Scotland saw a bit of a push from our hot food takeaways and drive-throughs, given that policy that was set out in National Planning Framework 4. I think they were trying to beat local development plans coming into place. As you say, the wording is there about, for the local development plan, about potentially identifying locations. We're not in the business of providing drive-throughs or hot food takeaways, so I think we would end up having a local policy in there about what we would do should further applications come in to assess them against. And the last one about retail in there, we're just embarking on preparing the next local development plan. And one of the pieces of work we've been doing is doing some surveys of our settlements, just in this whole principle of local living. You might know it better as a 20-minute neighbourhood that's been spoken about. In Dumfries and Galloway, given the rural nature of what we have, we're not really looking at 20-minute neighbourhoods because we don't have many of them. So we're talking about the principle of local living. And one of the big things we're actually looking at is the availability in our community of affordable, healthy food. And we're finding in a lot of places that, smaller, like Russell spoke about, like Kirkconnell, Kellerholm, maybe have a Nisa or a Spar. And yeah, they have some element of fresh food, but it's not affordable. It's maybe only your bigger towns where you have, I'm going to just Aldi, Lidl, those kind of places where, yes, you do their Super 6, their Fabulous 5 or whatever it is every week. So it is more affordable for them to have that. So the choice, we think, tends to be that quicker, processed, whether it's hot food, takeaway food, ping it in the microwave, whatever. So that is something we're looking at in terms of how it's going to influence that spatial framework that sets out in LDP3. And we can't ignore the role that our local place plans are going to have on this going forward. We've potentially got good coverage. We have about 45 communities who are preparing local place plans. To be honest, the first round of these are very much the kind of versions of what were community action plans. So a lot of them haven't taken that step forward to these bigger, high-level issues. A lot of them are focusing on bus provision, housing, potholes, which is immediate issues. But I think we can get into this with them in the next iteration. It's a big step to move it forward. So, and the next slide that I've got is, I think Valerie spoke about kind of direct actions that we can perhaps get involved in. And the first one really is about this limiting hot food takeaway management zones. But like everything we do in development planning, it all has to be evidence-based. Because ultimately what we do, if we have a policy in our local development plan about, there shall be no more hot food takeaways within this area, we will be challenged on that. So ultimately it will go to an examination that an independent reporter is assesses what we've put in. So we need to have that evidence to demonstrate why we want to create one of these in any of our settlements. So it's not that we won't look at them, we will, but again, we would need help of people around the table if that was considered something we want to progress. And I think as well, it's just to highlight that it's also the role that, as it says there, the access to areas of open space, green networks, play parks, allotments, good quality housing, even work we're doing with Wheatley Home South, it kind of Lochside with the master plan. It's not just about identifying areas for new housing, it's that whole proper place plan principle about the social, economic and environmental, and about how that impacts on places where people live, particularly if they have less of a choice in where they live. I think we need to recognise that role as well. So it was just to say, we are so pleased to be involved in all of this. I think it's a big step forward from where we've been, and that recognition about the role that land use planning has in shaping this environment going forward. So as I just say, I'm so pleased to be part of this discussion. So thanks very much.
I'm going to take these next two slides. It's about strengthening public sector procurement and provision standard, and also kind of links to the out-of-home sector as well, because the kind of principles are kind of similar. So really, this is challenging us as public sector organisations, and we provide food, or where we subcontract to let out providers who are providing food, and really looking at us and leaders in this space in terms of what can we do. And what the evidence suggests is that actually it's about promoting healthy food, and actually trying to make that up to kind of 75% of what is being promoted. That tips people over the edge in terms of choices that we make. Actually putting price promotions on things that are healthier. There tends to be price promotions. What we see is price promotions on things that tend not to be of a healthier. And in terms of kind of reducing calorie content, it really is more looking at that portion size portion size that are given. Reformulation can sometimes have unintended consequences because that can sometimes lead to more ultra processing in food, can lead to higher salt intake. So you don't want to replace kind of one not so good thing for another not so good thing. But certainly portion size is something that it can be looked at, and provision of free drinking water. So I suppose a challenge to us all in terms of what we provide within our catering session areas. You know, do we really do what we can to kind of maximise what is on offer to promote health? So again, that is an area where action can be taken at that local level to really kind of commit to that. So the out-of-home sector, and Russell has obviously kind of highlighted some of the challenges in relation to that. We've got that economic balance that you want to do. But it doesn't always have to be at the detriment of making something financially viable. Again, it's about looking at, you know, portion size. I mean, we know that some of the venues that we can go to and the portion sizes they're just huge. The sizes of kind of cake, they're absolutely huge, and can be more than, you know, your day's calorie content. And actually, it doesn't make, you know, kind of you know, you could reduce the portion size and still maintain your profit, you know, profit margins as well. So again, it's about how to kind of rethink some of this that enables that. Again, having those healthier options as the more visible options, and having healthier choices, and then adopting healthier cooking practices, because you can have fish and chips that can be cooked in a way that is healthier than having fish and chips cooked in another way. Public Health Scotland and the Food Standards Agency did do some work which was looking at kind of eating well out of home, and they kind of developed a framework which had kind of like, I think it was 9 principles that out of home sector could look at to increase and improve kind of the healthy offerings that they had. And it was things like, well, increasing the portion size of vegetables, reducing kind of totally calorie content by you know, reducing the size of portions. And that seems to have evaluated quite well in terms of kind of shifting that balance of what has been on offer. So there is opportunities. That is there is an evaluation. Happy to send the link, and it is being discussed further by Public Health Scotland and the Food Standards Agency. But again, is that something that we might want to look at and test out in Dumfries and Galloway? Interesting maybe to hear Sosie's perspective, because I know they do quite a lot of work with the out-of-home sector in relation to that. So I don't, have we got any hands up, Sandy?
I'm not seeing any.
No, I just want to check. So I'm just
I think Stephen was.
Oh, sorry, Stephen, sorry.
Just in terms of, I take it, it's just an observation, but I'd imagine 3-4 generations ago, all our families would have been on the land, let's say, and now we're all townies, right? So you know, most of us. But there seems to be an assumption that it's a consumer economy. This is really about how we shop, rather than, you know. So, and I know there's elements here which is about food growing, good food nation, food strategy, etc. But there seems to be very little emphasis, other than nominal or token, towards like how do we grow, change the, you know, the lifestyle sort of thing. We grow the food we have locally, so there's a food independence about it. So it actually means you don't have to worry about what's on offer in shops, because you're actually growing the stuff locally anyway that's healthy. Now I know farmers do this anyway, but it tends to go through a route to market and then come back to us through the shops. But I think we've almost like said, oh, it's all about consumerism now and sort of buyer choice. So is that something that's baked into some of the assumptions? Because it seems to be predominant, the last couple of slides seem to be around that. And just to say, I'm interested in this digital arms race between influencers who promote good food, bad food, in the same way as you might have, it's just a digital version of fish and chip shop in Kellerholm next to a health food shop. So does it end up being like that? Anyway, that's just an observation. So thank you.
So I think, Stephen, I'm going to hand over to Chris in terms of the Good Food Nation, because I do think that is quite a that is looking at kind of food policy from quite a different, and that is that issue about actually how do we grow local, how do we make our supply chains, and I suppose in that public sector kind of procurement piece, there's what could we do, and what can we do in that space now. How do we procure our food? Is there opportunities for us to do it more local as well? So you're absolutely right. There is a role in this, and I think, as I say, the Good Food Nation is something that can maybe help to kind of move that kind of conversation on. So and I see Russell wants to come in as well. Sorry.
No, I was just going to say the Good Food Nation's interesting because it's up to local authority to write a Good Food Nation plan. And there are now inspectors that will come around all the local authorities to look at whether so that is now a key responsibility of the local authority to write the Good Food Plan for the Good Food Nation. And there is now, and they were created about 6 months ago, now a Good Food Nation board whose role is to come around all the local authorities, is to make sure that they have that plan in place and to make sure that it's being done properly. So I was just a point of information more than anything else. But it's one of these things, Stephen, that's on your list of things that has been given to you by government, which is to write a Good Food Nation report for Dumfries and Galloway.
I think it's in training.
And with that, we will segue on, and I'm just conscious of time. We have been having discussion, throughout this, but I really would like to get us to have a bit of time online to discuss and in the room to go, well, actually, what do we think we could genuinely do in some of this space? So if we could put the slides up, and I'll hand over to Chris, who will talk about exactly the Good Food Nation.
Yeah, so a lot of awareness, I think, is already in the room about the Good Food Nation and also online. So in Scottish Government been very active in producing all of this legislation to try and promote healthier food choices and growing a healthier food economy as well. So there's the current team working across the NHS and the local authority to help develop a regional joint Good Food Nation plan. So thanks to Thomasina Lockhead and Patricia Riley for pulling this work together, and they're the driving energy behind the work in the local area. So that, as has been touched online in the room, the scope of the Good Food Nation plan does touch on almost every aspect of the food economy: consumption, production, retail, ending up the food on your plate, and how affordable it is. It's a vast undertaking, really. But fortunately, Dumfries and Galloway have been successful in securing the support of Public Health Scotland. So there's going to be a pilot on looking through the Place Standard tool through a Good Food Nation or food lens. So that's going to be piloted in 2 areas in next month, I believe it is. So that's going to feed into the national pilot, and in turn that will feed into the action on the Good Food Nation plan.
Can I just assure Russell that I think there is a good food. I think our plan comes to committee in summer 2026, so it's in train. Just to let you know. I'm sure Dawn will be able to confirm that if need be.
I think there is work, because it's a joint one between the NHS, because there is that responsibility for the NHS and the local authority to produce one, and rather than do 2, we're joining up together. So I think that's a really positive step for Dumfries and Galloway, and I think is a real where we can progress some of these things. But I don't know if Dawn wanted to come in on that, but it is in train.
And if I may, Stephen, just to say, I'm not saying this was a good idea. I think this is a sledgehammer to crack a walnut, if I'm really honest, by setting up an NDPB, which they have done, to do all this. And that's a point we've made to government. But that's what it is. So there will now be I think there's 5 inspectors that will come around. And I mean, I won't go on, but I just think this is a sledgehammer to crack a walnut.
can put the slides back up and we'll go through it. So, oh, sorry, Dawn. Sorry, apologies, Dawn.
No, it's just you invited me to speak. So yeah, absolutely, the work is in train as described, and it's, you know, it's an important contributor, I suppose, to the overall. But I think the regulation side of it, as Russell has indicated, is perhaps something to reflect on in terms of something we might wish to you know, raised through Claire and others, you know, because it does seem overbearing in terms of something that should have a, you know, a positive impact in terms of our work moving forward. So just want to reflect on in terms of the regulation side of it, as Russell's indicated.
Great, thanks, Dawn, and Claire's here. So I'll just move us on to. I've got a couple more slides. So Chris Topping, you're online. We can't see you, Chris, but are you okay to speak to this slide?
Yes. Thanks, Valerie. Morning, everyone. It was just to confirm the new multi-agency physical activity strategy was launched at DG1 in January after being approved by community planning at the end of last year. And it's a life course strategy covering early years all the way through to older adulthood. And I think the development of the strategy reflects much of the conversation or many of the points raised today. So complexity, focus on prevention and early intervention, collaborative working and working across the systems using systems-based approaches. The strategy, and I'm not going to go into it in any detail, really does aim to increase population levels of physical activity in Dumfries and Galloway, but with a real focus on trying to support those who move least to move a wee bit more, and also to look at that muscle strengthening piece, which ties in with healthy weight outcomes as well. So in terms of where we've got to after it being launched, we're now moving from planning into implementation. So we do have now formed a new multi-agency leadership group who are going to drive that implementation of the outcomes and actions within that strategy. We're in the process of developing action plans across those 8 subsystems, and we'll have leads for each of those 8 subsystems that Valerie mentioned earlier. Because what we're keen to do, and it's been a theme this morning, is we know that decisions in one part of the physical activity system affect decisions, outcomes and outputs at another. So how we build our transport infrastructure influences how our school children travel to school, how we travel to work. So it's trying to understand as a system how we can support more people to move more often. We're also putting in place a robust monitoring and evaluation framework to track progress and implementation of the strategy. And we're working with Public Health Scotland and national colleagues to try and inform what a systems-based plan would look like. And we're also going to be reporting regularly to community planning partners and leadership teams around how we're getting on with progress and how we're going to align and deliver the strategy across all 8 subsystems. In terms of the role of the community planning partnership, and there's been a number of conversations. It's about how do we encourage and enable the whole systems approach to increasing physical activity and muscle strengthening. So how do we work together? How do we find the levers? How do we influence that change? About providing leadership and advocacy to support delivery. And again, that's been touched on this morning. How do we embed physical activity into policy planning and everyday practice? So it's looking at where can we change our policy in terms of planning and design? How can we change our policies within schools, within health, that can create that supportive environment or create the places and spaces that can support more people and those least active to move more? There's always that piece about how do we look at resourcing, but how can we change how we invest in certain programs? How can we shift resource? How do we get new resource? And how do we align it to those actions, and those actions that are going to support prevention and early intervention, and those, again, who move least to move more? We've done a significant amount of work in Dumfries and Galloway looking at what the best investments are. So what we're doing currently, how is that supporting those moving least to move more? So we've got that in terms of those programs and projects delivering the best return on investment across all 8 subsystems. I'm happy to share any of that. How do we increase across community planning across our region awareness and opportunities to promote muscle strength and balance, to support our communities to age well, to prevent falls, frailty in our communities, and some of the challenges facing health and social care systems. And as a community planning partnership, we employ across our agencies and our organisations a high proportion of our population. So how can we create workplaces? How can we create workplace policy and practice that could support our employees, our staff, our volunteers to move more to and from work and during work? So that would bring in place workplace, active travel, active recreation as well. So those could be potentially levers or opportunities to create a more active population. Thank you.
Great, thanks very much, Chris. I know there's been huge amounts of work done on the physical activity strategy, but the ask is that we actually do make that implementation happen. So again, it's like as us around the table, how do we keep this on the agenda? How do we keep focusing on it so that it doesn't sit over here and just not actually happen? And as community plan and SLT, we're going to get updates and understand maybe some of the barriers that are to that, and we will bring them back to board. But I guess the ask around here is, please remember these strategies. Please try and embed them in your organisations as well. So I think we've got the last slide before we're going to go into discussion. Our discussion time is going to be a bit curtailed. But Ethne, are you online? Are you able to talk to this slide? Yep. Oh, brilliant. Thanks, Ethne.
I'm here. Yeah, last but not least. Yes, so there's an absolutely huge evidence base for the health benefits of breastfeeding, both short and long term for infants and their mothers. And this includes reducing the risk of overweight and obesity. And that is, again, for children and adults. In Dumfries and Galloway, we do have comparatively low rates of breastfeeding compared to national averages. Obviously, we have an aim to improve this situation. We've got a stretch aim for 2030. Of course, it goes without saying, infant feeding and how parents want to feed their baby is about choice. But I would argue that parents can only make a truly informed choice if they live in a society and culture that supports them to breastfeed, if that's what they wish to do. And we know from the UK infant feeding survey that 80% of women reported stopping breastfeeding before they planned or wanted to. So one of the ways that the culture is being changed in Scotland is through the Breastfeeding Friendly Scotland scheme. And we are adopting that in our region. It has 4 elements. The first element was around businesses and public premises and just asking them to sign up to a scheme, put some signage up, be welcoming to parents and babies. We're now working with early learning and childcare centres, and we'll be moving on to schools. And our final goal is that we have a local authority in Dumfries and Galloway that is breastfeeding friendly and meets the standards for that award. And that's our ask of you, really, as a group, is to embrace this Breastfeeding Friendly Scotland scheme. And hopefully we will have a breastfeeding friendly local authority eventually. There's also a couple of other points on this slide. There's just stuff about encouraging the introduction of healthy complementary foods for babies at around 6 months. Sadly, some of the highest sugar and most ultra processed foods available are commercial baby foods, and they are often incorrectly labelled that they're suitable from 4 months, when the World Health Organization states that, complementary food should be introduced from 6 months. And then some stuff about the Best Start Food Scheme, which is financial support for low-income families with young children and pregnant women. I think the estimate is that something like 1 in 5 eligible families in Dumfries and Galloway aren't taking up that. So, on the whole, quite a good take up of that scheme, but still 1 in 5 not taking it up. That's it.
Thanks.
Thank you. Is there an element of and forgive me for my ignorance, but is it like political parties and football teams that there's a generational thing where what your mum did will be what you do, more likely has a greater influence rather than any marketing or whatever? I'm just curious about that. Thank you.
Ethne, do you want to come in on that?
Yeah, I mean, to a certain extent, obviously there's family patterns and a lot of obviously there's a strong correlation between breastfeeding and a woman's level of education. And also, obviously, in poorer communities, we see lower breastfeeding rates. So there is a cultural thing, but also there's a massive impact from marketing. And formula marketing is huge in the UK, and it isn't nearly as regulated as it should be, in my opinion.
And is there a reason why that has had more of an impact in Dumfries and Galloway?
I think it's to do with what legislation we have. So I won't go on too much because it's a little bit complicated, but there's two levels. So there's the World Health Organization strategy around marketing of breast milk substitutes. And then there's what the UK government has adopted, which is not the full code. It's not the full World Organization code. So there's some things are allowed to be advertised within the UK and therefore in Dumfries and Galloway, and that tends to be around first stage formula cannot be advertised, but follow-on formula can be. But we often see in supermarkets, first stage formula shouldn't be put on reduction. It shouldn't be being promoted to families. And yet just the other week, someone told me that there was a supermarket in Lockerbie that had some first stage formula on its reduced counter. And actually, when she further looked into it, that was actually out of date. She took it to the manager. So there is always, the law is being broken and it's not really enforced very strongly.
I think again though it's what can we do locally in terms of that culture, in terms of that environment, and becoming a breastfeeding Dumfries and Galloway, having our organisation supporting that scheme helps to embed that culture. I'm just very, very conscious of time for discussion, so I'll bring Dawn in and then we'll just move into breakout rooms for a few minutes. Sorry, Dawn.
I'll be really quick. Firstly, there was mention a few times about breastfeeding friendly local authority. I'm assuming we mean region rather than the organisation, as a place. So I just want that clarity.
No, it is actually the local authority itself would sign up. Yeah, we're not there yet. We're still working our way through the stages. Yeah. But yes,
well, thank you for the clarity.
Yeah.
Yeah, that's great. And I think there's just something for us to reflect on in discussion around our role collectively as major employers in terms of, the support we give to our staff, who might be new mums, need to express milk in the workplace. There's all of the support we can give to our workforce, but also the responsibility we have for, network of publicly accessible buildings, and whether we are providing safe spaces and comfortable spaces sufficiently within communities for breastfeeding. And I think that's something we can reflect on. I think about the council, and we've got, our network of libraries, customer service centres, museums, leisure centres, is there something that we can do? And the same will apply to other partners sat around this table. So really, I'll just encourage a focus on this. It was been last on our list, but it's important. So let's not just think it's not as important as some of the other things, because I think it is. Thank you.
No, absolutely, Dawn. And if I can put the last slide up, I'm conscious of time, but I think it would be good to just have a little bit of a discussion. We had these 3 questions. You were meant to have 25 minutes, but this has been so topical, and great to have this level of engagement in the stream. 3 questions that we have got. So what areas of focus in terms of local levers do we want to, as a CPP, concentrate on? What could we commit to either in our own organisations or sphere of influences, and again what support is needed in relation to that? And also another one is actually there's significant engagement that needs to happen as part of the Good Food Nation that is legislated. Kind of what questions do we might want to ask in those pilot areas about all of our communities as well in relation to that. So we have until 11:25 for this session. Sorry, Mark, do you want to?
Well, no. I mean, I was just going to say that we have a break at 11:25. So I was going to suggest that if we break off and come back at 11:20 to give the facilitators a chance to give us a brief bit of feedback, but we should respect people's time to try and stay within the.
Absolutely. So what I would propose is that if we could go into, so we're going to stay in the room as a breakout room, online are going to go in to there. So I think we'll pause the live streaming just now for the breakout rooms, and we'll give 20 minutes, and then we'll get feedback for 5 minutes from the facilitator. So Chris Topping's going to be the facilitator online, and I've talked a lot, so Chris Allen's going to facilitate in
Sorry, we were just being told that the public link is now being reconnected. So.
Okay, thank you, Chair. So item 4 is about the Place Director role and the links to community planning. And the role of Place Directors was revised in 24-25 in providing that connect between Scottish Government and local community planning partnerships. A new proposed charter, just to clarify role and opportunities, was circulated in December. It's not the final one, there's just some, I believe, some final tweaks being made to it. And of course, you all know Claire Rinton, our Place Director, and I'll just hand over to Claire, who's going to take us through some slides. Thank you.
Thank you. Appreciate having a seat at the table and be part of the conversation, so thank you very much. So I'm Claire Renton, I'm Place Director for Dumfries and Galloway. My day job within Scottish Government is in DG Economy. I work on employability and activity and skills for the economy. I'm also got the benefit of some support colleagues online, and I'll just invite them in just now. We can't see you at the moment because we've got our slides up, but I'll maybe just call out. So Phoebe, do you want to say hello?
Thanks so much, Claire. I hope everyone can hear me okay. It's lovely to join you all today. So my name's Phoebe Williams. As Claire mentioned, I'm sort of one of 3 that are on the support team for Claire, and also supporting our Place Director as well for Borders. I'm based within the Mental Health Directorate at the Scottish Government, specifically working on mental health workforce policy. I can hand over to Roz. Thanks.
Hi Phoebe, yeah, I'm Ros Curry, obviously also part of the support team for South of Scotland Place Directors. My day job in Scottish Government, I work in the Strategy and Delivery Directorate, currently running the Directorate Hub there, so kind of overseeing business management and programme and providing strategic advice to our director there. I think Ralph is also on the call, so I'll pass to Ralph. Possibly. He may have been called away. In which case I'll pass back to you, Claire.
That's fine. So Ralph is another trusted colleague and works currently for emergency response and resilience, and I know has got strong connections with Dumfries and Galloway's team as well. So I was just really keen just to get a short amount of time today just to raise the profile of the Place Director role, and obviously put on the table about, you know, how can we help and support and get to know you better. As I think we've rehearsed this morning, it's about partnership working. Not one of us alone can achieve some of these wicked issues that we've got on the table, and it's how do we work better together. We're really keen to improve that link between Scottish Government and local government and partners, and saying, you know, how can we help achieve national aims with local action? It's a sort of key buzzword. Can we, actually, I can do slides myself, can't I? So there's a wee bit of sort of just context and background in terms of, you know, there's a very strong Verity House agreement which details how local government and national government work together. There's also a review of the Community Empowerment Act, and obviously that's really important because it's about how CPPs will operate going forward. There's also a lot of wider reform programmes going on, and obviously we've touched on the population health framework this morning, but public sector reform, health and social care service renewal. So there's so much going on, and there's so many networks that are getting built around supporting these items. So it's really just important about how do we connect and work well together. I'm not saying everything is perfect, but I think there's that real intention there to say how do we connect with each other. There is sort of key frameworks in terms of how are we approaching this, around, you know, accountability in terms of how do we set our expectations and our roles between partners, because there's a lot of people doing a lot of things, and how do we make sure that there is meaningful engagement with communities and third sector to help inform a connected working approach that we actually make a difference. There's obviously a lot of legislative and guidance focus on that in terms of CPPs, and how do we make sure that the structure and the governance systems are right so that they add value and just don't add burden. We talk about collective leadership, but again, I think you've really spoken about it this morning around everybody that's around this table virtually and in the room has got an interest, but also something to contribute. And how do we connect with you as place directors? And every local authority has got a place director So there's 32 police directors and the support teams around them. It has been going since 2018, so quite well established. But what I would say is now what I'll go into, there's a real re-energising of that at the moment to say it's really, really important, and that's where we're going to add value. And like all of these items, it's about communication, understanding and engagement. That runs through the heart of everything that we're dealing with. Right, next slide. So, the Scottish Government and COSLA are working on a police charter in terms of actually strengthening this, taking a lot of the learning that we've got and how do we make it stronger. We want to make sure that all our stakeholders are engaged, and I'm really grateful for everybody's time. You know, I've spoken with the Enterprise Company, obviously Dumfries and Galloway colleagues, Val and NHS locally, Stephen at Police Scotland, Douglas at the college, and trying to really get down to, and Alan, of course, in the third sector, in terms of really just getting to know you and building that trust and understanding of what your world is like and what we can do individually and collectively. Now, as you can see from Phoebe, Ros and Ralph and myself, we have got a broad range of experience and networks across Scottish Government, and we have taken on board the points that you've said this morning, and we'll reach out to our networks in terms of making sure we feed it back. But we really want to do more, and this charter is a way of really underpinning this and saying actually how can we formalise that a bit better in terms of using all this activity and connecting it, and also just seeing, again, I'm really keen on the local aspect, say what is happening in Dumfries and Galloway, what is working well but equally not working well, because I really want to showcase a lot of the good work as well, because sometimes we do hide our lights under bushels. And in terms of the charter, that's what it's been mapped out at as a result of all the engagement, really making that commitment about what police directors and our support team will do. You know, attending the CPP, I think I found that absolute wealth of knowledge and information about what you're doing and how you're doing things. We are, I'll say, with given a degree of management of expectations, we are all volunteers because we're here because we want to do it. So you have got our hearts and minds in relation to that. We're required to commit at least 2 days a month on top of our day job in relation to this. But I really see it as an integration of my day job, because what I learn and see and are able to discuss here helps me with my day job and my development. And I think my colleagues around the table feel like that as well. In order to make this work effectively, and I think it has worked really well because we've had that, you know, reach out, is there are sort of guidelines in terms of how do you make the best use of us and how do you get us integrated and inducted so we can be useful to you, and again, not adding burden. So that's been set out, and I think that's really helpful for us in terms of actually just making sure what we're doing is right and connected. We want to act as ambassadors back at the central part of government in terms of who you are, what you're doing and what your voice is. We want to help deliver and remove barriers and obstacles and what your wicked issues are. And I will, you know, emphasise the fact that our First Minister is really starting to use us as police directors, so I'm really finding it ramping up as part of my day job. We meet about collectively every 6 weeks as police directors across Scottish Government, and we get all the key policy areas in, so we're constantly getting informed and educated on what are the, you know, whether it's PSR, whether it's population health framework, so that we've got a good overarching knowledge. We also are getting asked to do deep dives, and we also did put my hand up in terms of child poverty, and we're having a separate discussion to really focus on that, because I know it's really important for you as the region as well. So it's really getting in about, you know, what's the data saying, where are the barriers, what do I need to take back to colleagues across government to say this works or this doesn't work for this area. So that's going to be our first test approach. Again, I'm really also keen to understand, you know, what do you want to achieve and where do you want to get to. And I know as part of the paper we're like, well, do we just hone it around 2 or 3 things that we can really focus our collective effort as your support team. So we want to build trusted relationships with you, and you know, as I was saying to Mark, we want to, you know, we're pretty thick-skinned in terms of hearing honestly what it means. We want to attend CPP meetings. Obviously, me being based locally makes it much easier to do that. I know the team are really keen to get down as well, so maybe the later starts will help us get Ros and Phoebe and Ralph down. Ralph and I did attend the convention in the south of Scotland the other week, and again that was really good, because I think you can't beat being on the ground and meeting people in person to know and understand that. And I've certainly had some good follow-up meetings. I have contacts at CPP, meeting with the youth work services, and obviously the young people that were created the video and the work in that. So again, it was really good for me to hear their voice and to say, well, what can I do to help? And equally give some feedback to say, well, these are maybe next steps you might want to think about with your group. Again, we're not here to tell you what to do, but I'm happy to share information. And I'm also happy to go back, I went back and things like, I know that we had the discussion on vaping, to actually influence colleagues who are leading on the vaping policy and make sure, again, the messaging that you're surfacing locally is being heard and maximising that local intel. So really welcome just having that space today, obviously introducing the team. So again, you know faces and you know names. And again, if it's not us, we'll know somebody or we'll find somebody in relation to that. And yeah, just want to make sure that Dumfries and Galloway's voice is heard and seen, and that we are here to help you and not be a hindrance in any way. So thank you for giving me this time and space. Happy to get any feedback and happy to have any discussion around if there's really focal points that you would find beneficial for us to take forward. So thank you. I'll hand back to you, Stephen.
Thanks, Claire. So really, as board members, it's just really to open up in terms of any key priority areas that we feel we could link in, or just to help prioritise that for the coming period.
Thanks, and thanks, Claire, for the presentation. It's just a question, obviously you'll have been aware from the costs about the discussions about rural impact assessments, and I think there was a spokesperson from the Scottish Government there at the time who sort of said, oh well, we're taking more account of that, but it wasn't the same really as a legislative rural impact assessment, which I think what the sort of plea was across the forum, and certainly been raised at COSLA, which is local authorities' vehicle for taking that up. So I think there's something there that could be stronger, I feel, if we're serious at a national level about listening to the rural communities across Scotland, including ourselves. So I think that would be my message, would be like, can we look harder at that and maybe sort of deliver something possibly through national legislation that takes into account of that. In terms of the local priorities as well, I mean, you'll have heard today, but I think there is a desire to push up the way and say, well, actually, for all our actions and local initiatives to work where we have that span of control locally, which I know Valerie's keen to do, as many others are around here, like, let's make the most of what we've got here within what we can do, but that's going to be influenced to a great extent in terms of that national framework, whether it's Scotland or UK, in terms of like advertising, what's legal, how do we control digital marketing, television, all that sort of thing, so if we can influence that and help us strengthen what we do locally, that would be really helpful, and if that message could be taken back, I'd be grateful. Thank you.
Thanks, Councillor Thompson. Absolutely happy to do that. I know Anna Densham was there from the Rurals team in terms of RIAs, so we'll certainly take that back, that messaging. And what I would sort of give reassurance, certainly my policy areas that I lead on, we have a suite of impact assessments, and absolutely a rural impact assessment is absolutely key, and getting that lived experience in terms of informing that. I think it's a good reminder about the convention in the south of Scotland, because obviously we had the depopulation team there, and I know both SOSI and Dumfries and Galloway Council have been working and successful in terms of that area, and we've been part of that to make sure that we're securing opportunities for you. And also there was a very strong skills paper at the meeting as well, which we've taken and I've put on the agenda with skills colleagues to say, we're hearing this from the south of Scotland, actually what can we do to support, enable some of the barriers that have been put forward. So again, just want to reassure there is proactiveness in relation to that, but we'll certainly take that back.
Anything from anybody online? I don't want you to feel that you're not in the room, so you don't get to ask questions or contribute. Yes, please.
Hi, thanks, Mark. Thank you, Claire, and I really welcome this work. And I know I'm aware of the development of the charter through the Solace route as well. So really welcome this. And I'm just wondering what you and the team feel you need from us in terms of developing understanding, awareness. Obviously, your attendance at the meetings is really valuable. But you know, what more do you feel you need? I'm more than happy to have an online conversation with the four of you. You know, just to kind of talk about the region, my perspective on the Lloyd priorities, my perspective on, you know, what the most significant issues are for us, and more than happy to do that. But I'm just interested in what will work for you as a team. Conscious, Claire, that you've got experience of working here and locally based. So I'm just conscious that perhaps other members of the team, this is perhaps not so familiar. So just keen to hear from you.
Thanks, Dawn. I really welcome that opportunity, and you're absolutely right in terms of we're really keen as a team to come down and get a bit of time here so Phoebe and Ros and Ralph can get that level of understanding. So really welcome your time in doing a sort of induction piece in terms of what are the key stats, and I'd welcome that for other colleagues as well. So your time would be, even just a small amount of your time would be hugely beneficial. I think it's about how do we work effectively? What are the key contacts or the key people in your organisations? Because I appreciate as leaders you're very, very busy, but what are the meaningful contacts? I know Stephen and the team have been very proactive with us, and we're working closely with third sector, Alan and colleagues as well. So it's about ways of working as a sort of network within your key contacts in your organisation. So if you have somebody, you know, whether it's housing or whether it's skills, it's a key point of contact that can be the conduits between our team and your worlds. I think that would be really helpful and probably an efficient and effective way of working. If there's any, I call them shovel-ready ideas or projects, you know, if there are things that you develop but you don't know how you're going to take forward, I guess giving us some insight of that so we can look for opportunities across Scottish Government. I think that would be really helpful for us as well, because we can proactively go to policy areas. And it's getting to know enough so that when we're having policy and strategy discussions in Scottish Government, we can make sure that we are more than adequate in terms of representing that initial conversation, or have you thought about, have you done? So it's that influencing piece back up the chain. So I think there's a little bit of trial and error there about what works for you. But if you can maybe have a think about that, any offline conversations would allow us to progress that a little bit more. You know, even just being here, and Douglas and I bumped into each other and just had a really, really good conversation over half an hour. It's really, really valuable in terms of sort of downloading what your priorities are, and that gives me thoughts about what I can take back and take forward. So I think creating those chance encounters. You know, another aspect I'd sort of wondered about was also trying to maybe be based, you know, even like it was one day a quarter or something in an organisation, because there's been times that I've gone up to the college and worked out the college, and just being in that environment is really powerful for hearing chance conversations, hearing and seeing what's going on. So again, if there was any opportunity to explore that, I'm trying to figure out ways of getting more intrinsic sort of sense of the organisation. And I'm also looking out for other people that I know that work across the public sector that are coming out of Dumfries and Galloway into Glasgow or Edinburgh. I know there's people in PHS, for example. And I was like, I wouldn't mind trying to get a way of working with you locally, because that allows us to connect up. But that's probably a sort of medium to longer term aspiration. So, Dawn, you did ask, so I have got lots of thoughts there.
Because I'm the chair of the Community Planning Senior Leadership Team, Claire, and I just wonder maybe if there's something about maybe one of your team might want to join that meeting and kind of hear some of the stuff, because sometimes what comes out at that bit is maybe competing policy priorities that we're trying to wrestle, and different funding streams that are coming that are, you know, maybe making things, you know, so that might give maybe a wee bit kind of like that kind of insight that might be helpful as well. So if the board were comfortable with that, and if that was something clear that maybe one of your team might like to join, it's once I think every 8 weeks, Stephen, or so that we meet. So it's not a huge commitment, and there is an online option. We try and meet in person, but that might be there's something just maybe as an initial kind of building up of kind of connections might be something that maybe want to explore.
Don't want to speak for my colleagues. I'm trying to gauge facial expressions online, but that feels like good offer, doesn't it? Rose is nodding. I think Ralph's nodding.
Sorry, I'm happy to cover other groups. Sorry, I was just about to put a message. I think, yeah, thank you so much for that offer. That's really kind. I suppose if you have a suggestion of the dates of when those meetings are likely to take place, we can maybe have a discussion between ourselves about, you know, what feels most feasible and what we could manage. But yeah, we really appreciate it. Thank you.
Thanks, Chair. Yeah, sorry for coming back in again. It was just looking at the little chart there. It's got the place directors will, community planning partners will, that induction part. I think we might have something in train. I'm just looking at Dawn, but I'm sure there's a kind of meeting hopefully due to happen at some point, so keen to be part of that. There is something about the language about going back to, you know, it's, on the one hand you're a sort of emissary from the Scottish Government and you will go back to them. But then there's the other part which, like, you've been here, embedded here, if you like, and there's something about that decentralisation of Scottish Government functions which would be maybe a better way to be national rather than central. Do you know what I mean? So there's something maybe about the language that we use to talk about this, but I'd rather feel that if you're the emissary from the Scottish Government coming here to go back, that there's more a sense that you're actually here as part of the team here to help make government and local work better, so it delivers locally when we're talking about national stuff. So it's just a wee comment about the language there, but thank you.
Thank you. I see on there, please.
Am I okay to come in? You're
yes,
breaking up a bit. Thanks. Hi, Claire. Nice to see you. I really just wanted to echo Dawn's offer in terms of support and assistance. I know you know Susie already, and I'm sure that Jane and Russell will have made the offer already. If there's anything we can do to support and assist information, etc., let us know. Very happy to provide that. Thanks, Jeff.
Perfect. Thank you very much. And I think the message seems to be that the door to collaboration and communication is very much open, and I think that's absolutely what we need. And I would encourage us all to use it because collectively we can do more together. So thank you very much for giving us the time, and we look forward to working with you further. Thank you. So if I can move us along to item 5. Which is the business brief, and I see some of the things in there got us very engaged at the COS meeting in Melrose a couple of weeks ago. So I'm very keen to hear from Stephen and Andrew Reid on this.
Okay, thanks, Chair. So we've got some general updates that have been worked through the senior leadership team just before we bring Andy in on addressing depopulation. Just the first section, just for noting, so the good news is that we've got board meetings now fixed in the diary until March 2027, so that was a little bit of a challenge, but we've managed to get all that sorted, and that meeting's going to be scoping out on the poverty and inequality strategy, the development of the new poverty and inequality strategy will be led through Mark Malloy. And a question had been posed. We've obviously trialled today kind of hybrid workshop, which seems to have worked pretty well. But again, it was suggested that maybe that one could be in person only. But we're conscious that may limit attendance, so happy just to take a steer from the board what would be preferable for that meeting. And I'll maybe just come back to that when we're still looking at June for an end of year review. There's 3 meetings, 18th September, 11th of December and 13th of March, which don't yet have themes, but one of those will have to go with the joint meeting with the Youth Council. Myself and Valerie also had an approach from Ed Forrest, the Director of the Biosphere, regarding new climate change partnership. And again, given that's one of the links to one of our LOIP outcomes, that might be an opportunity to have a theme discussion around that. So that's the suggestions so far, and keen just to take some reflections on that.
I've just wanted to play a full and active role in the Community Planning Partnership Board, so thanks, Chair. It might be of help, and I'm sure they'll be circulated more widely, but I did meet, just in terms of the biosphere, that's been part of a discussion with CABSEC for land reform, rural affairs, etc., which we had recently in Kilmarnock with leaders from South Ayrshire and East Ayrshire councils. So there's certainly a value to a discussion there about how we take things forward, about what happens after the decision re National Park, which obviously was quite divisive in terms of like what people felt about it. But there's a willingness across both government. I'm sure Claire's probably got sight of this to some extent, in the sense that Forestry and Land Scotland, Biosphere, various other organisations, Galloway Forest Park, etc., are all sort of interested in aligning, if you like, resources, even if there aren't new resources, to try and deliver better outcomes for local communities and for visitors and make it more of an attraction. So it's kind of like, is this the way that we can start to work better, both at government agency level, local level, etc., to deliver better outcomes and sort of achieve things that we're all in the room, but we're maybe not coordinated. And I think it was really a lesson in that. So it's just a wee bit of feedback there. Thank you.
Thanks, Stephen. Yes, good point, Valerie.
Yeah, it was just, I think one of the concepts that was kind of being looked at was a kind of regional climate adaptation partnership to kind of draw that together, Stephen, and certainly Ed is quite keen to kind of explore those discussions, and we said that perhaps it could come along to kind of community planning senior leadership team and have a conversation and explore that, and I think they would really welcome a conversation at that CPP level to go like what is possible in this space, what should it actually kind of be looking at to try and kind of coordinate that action. So I think they'd certainly be really keen to have that conversation with board members as well.
Okay, and any thoughts about the March meeting in terms of in-person, hybrid, or how do you feel about that?
I think in-person meetings are more conducive in a workshop environment. I would certainly vote for in-person, if that's okay.
I'm kind of a hybrid fan, insofar as like I think there should be sort of, there is a kind of digital by default thing, but I mean you get more, there's more to be had in terms of dimensions and communication channels if you're in person. However, I think if there's anything we've learned from, I don't want to forget what we've learned from COVID, because it's opened up whole other ways of perhaps people are being active at home, sitting in their treadmills or bikes, whatever, and reducing obesity. Otherwise, we'll just be driving about to sort of meetings and so there is something there about making it accessible, but obviously value in person. I'm sure the online part of the session will have come out with useful stuff today. So if it's productive, that should be the best measure. The rest is kind of a bit touchy-feely and emotional, but which I like. But it shouldn't be the measure of how effective we are. But it does help it. It helps us enjoy it better, I guess. But thank you.
Dawn online.
Yeah, I certainly prefer in person. So although I'm online today, and I think my suggestion would be that there is a strong preference for in person, but there are always circumstances that mean that people are unable to be there, and so provision of an online option is makes it accessible to all. So that would be my suggestion. Would be preference for in person wherever possible, but with an online option for those who are unable to.
That seems pragmatic. Does anybody else want to? I mean, presumably in the run-up to a meeting, you'll be able to determine if there is a need for a hybrid or if everybody can actually make it in person. So there might not always have to be a hybrid. And I would also tend to agree that having people in a room, there is value to it, simply for the interaction. But yes, sir.
It was just your latter point, because I agree with Dawn. I think given the people round the table, my diary pulls me away from the region quite significantly, because of the college sector, but I can almost guarantee that I would have the opportunity to then stop a meeting and go into an online session. So I really would, you know, prefer there was a Teams option, you know, and I feel, you know, from my organisation's viewpoint, we would like to contribute, and, you know, whilst we wouldn't be able to do it in person, we would be able to do it through Teams.
Are you happy with that, Stephen? That's what you need?
No, we've got some feedback,
Excellent.
and I think we'll do some more feedback with those who participated online as well, just to see what that experience was like as part of the post-evaluation. So, thank you. So, just some other parts of the paper, and we've covered some already earlier in the agenda, such as the membership updates. We've covered that. In terms of future governance of the leadership team, and it was just to highlight that Valerie's kindly agreed to stay on for a further year. After that, Valerie will have done a 2.5-year shift on that one. And it was put out or offered if someone could take on a vice chair role and work with Valerie this year to try and just build that experience and knowledge in the area with a view to taking on the chair role. But at the moment, we haven't had any takers for a vice chair. So it's just in terms of the future and conscious of Valerie's, you know, effort and time that she's been putting into it, it would leave a bit of a vulnerability for the leadership team if we can't, you know, fill those positions in terms of helping to drive forward for the future. So just a plea for respective organisations to have a think within your own organisation about that, and come back to us, please, if you've got a suggestion or nominations, who will take that on. Thank you.
Thanks, Chair. I think just on that point, firstly to acknowledge the fantastic work that Valerie's done, but I think important to acknowledge, having also been in the SLT, that it's a significant piece of work as the Chair and Vice Chair, and I think the fact that it's almost just considered an add-on to a day job is actually quite complicated. So I would be interested certainly in thoughts from Valerie's experience and others on the SLT about what actually capacity does it take, because I think we're leaning into the good nature of colleagues who wish to take on, and perhaps the reluctance of others to nominate themselves to go forward is because the sense of busyness in a day job. There's no extra capacity given in people's day jobs to take that on. So just a thought that actually would be helpful maybe for certainly for other colleagues in the SLT to get a particular view from Valerie's experience about what it actually takes to do that well, and therefore we can take on the role to encourage colleagues to take up those positions. Not right now, but at some point. Valerie, thanks.
No, thanks. That's probably helpful. Maybe we could scope out a bit of a paper about your experience, Valerie, because it is still relatively new, and just the time and the types of things that you get involved in. So I think that would be helpful. Okay, thank you. Just a couple of other brief ones before I bring in Andy Reid. I want to allow enough time for that discussion. We've covered the physical activity strategy and the Scottish Public Service Awards and the success with that, and the letter from the Cabinet Secretaries in the appendix. Just on the item underneath the CLD partnership, I was at the national conference yesterday, so it was announced that the national ESOL report will be available next Tuesday. So that's great time, and we'll take on board what the recommendations are there. The Fairer Futures initiative has been integrated into subgroup 4 of the Poverty and Inequalities Partnership, so that was just a brief governance check there. So I think I'm going to pause there. I don't want to run out of time and bring Andy in, who's hopefully on call to give an update on addressing depopulation.
Thanks, Stephen. Good afternoon, everyone. I'll just sort of give a very brief overview. You'll have had a copy of the report I'd sent to the leadership group. You'll be aware that the region, Dumfries and Galloway, is suffering or experiencing depopulation, but not just that, also demographic change, where we're moving to an older generation and we're losing the working age and children across the region. There was 3 reports which were funded by Scottish Government, which we undertook research across the region, which covered housing, an element of community engagement. That was with 3 different types of communities, because we recognise that Dumfries and Galloway, not one solution will fit everywhere, or not one thing is the same. So we had coastal communities, where we researched in the Rins. We had community we had the rural, which was covering the Glenkens area, and then a small town, which was Newton Stewart. That was sort of questions to ask individuals and community groups. why they stayed in the region and tried to look at the positives about why people enjoy living in Dumfries and Galloway, what keeps people here, why they want to stay, and what they feel could be improved to encourage more people to live in the region. Those 3 reports have now been completed. We've been sharing them with elected members in the council, and this morning you should have received, hopefully they've gone out at 10 o'clock this morning, everyone in the group here, and if you haven't, please contact me, a copy of the 3 reports, which will be released to the public on the 11th of February, which is next Wednesday, and they'll also be circulated to MPs and MSPs on Monday to provide sort of an insight to the outcome of those that work there. One of the key things that came through was individuals' sort of need for access and access across 6 factors, which was housing, employment, education, transport, health, and probably most interestingly was the social interactions and the sense of community and why people stay. People would live in a region because they've got friends, family, social connections, and that was one of the strongest. And within the working age population, one of the feelings that came around is that we were very good as a region at supporting interactions with under 18s through our youth work, and also at the older age groups at 60 plus with organised events at community centres. But it was that casual social interaction within locations that working age people felt was missing, the sort of the pub, the cafe, the community shop. So that came through. What I've highlighted as well within the report was sort of grouped the list of recommendations that come through, which you'll be able to get within the best interventions paper. But those 5 there were critical in sort of covering what we need to do. Changing the narrative is one of those ones which people's perception of rural nationally and internationally is that it's isolated, withdrawn, lack of services, and that's not always the case. So the narrative of rural being a nice place to live, and many people enjoy living in rural populations, and that we're not competing with cities for people there. We're competing for people who want to live in a rural setting. And the other one was that I wanted to pick out was making depopulation a strategic priority across organisations, because it's significantly changed in the decrease from our peak of 151,000 to just over or just under 146,000. That's a decline over the last sort of 8 years. It is fairly significant, along with that changing demographic. Now that the research is complete, I suppose work's now sort of turning to how we as partners, or how we can work better with partners to take this work forward and to look at what interventions we can do across the region. I have surmised very quickly what could take a very long time, and I'm aware that we haven't got a long time for discussion, but I'm quite happy to answer any questions.
So I certainly know, Andy, from an NHS perspective, that there's colleagues that would be quite keen to get involved in this, because obviously you've raised as well about access to services is coming out from the research. So it'll be really good to see actually what is coming out in terms of these reports, and looking at what that means, because obviously the landscape in terms of health and social care services is changing with kind of subnational planning and things. So we'll certainly take those back, and we'll get some connections in. I don't know if there's going to be a group established, but we'll certainly get some contacts for you, Andy.
Andy, thank you very much for the presentation, and also I had the benefit of hearing you at the convention as well, and I found that a really interesting piece, because I guess, like most people in education, I am the principal of the college. We're looking at what does it mean, for the future. We have an interesting situation whilst, and I'm conscious things like the new high school is being built for less pupils, but we're still experiencing numbers that we can accommodate in terms of young people within the college, and that's quite an interesting one against the backdrop of a declining demographic. And I think in terms of where we are, in terms of some of the solutions, the thing I'm particularly struck is that there's the need for cooperation and collaboration and actually some of the solutions are actually, you know, not quite at our fingertips, but if with a bit of collaboration we can push them. And I think I certainly would, I'm interested in collaborating, and I would also like if you had availability for you to come along to college and talk to my senior team about some of the impact of the research, because I think it is going to be critical that knowledge is important in collectively solving, you know, problems. Thank you.
Thanks very much, Chair. It's more of a comment rather than anything else. I was interested in the figure that's in page, let me just get the page off, page 36 in the report, how there was an increase up until about 2010. I'm just wondering, was that round about the time when I think Dumfries was in the national news of being the best place in the UK to live, and maybe that was the increase that was taking place there, because since then there's been a dramatic drop-off. I'm just wondering if that was the case. Thanks, Chair.
Shall I come? I'll come back on an all three. I'll answer Councillor Campbell's first one. Not 100% sure as to where the increase. I think you know, generally most places across Scotland were increasing at that time, so it's a general trend of increasing population. But I'm quite happy to go and have a look and see why that was, and whether it was actually the early migration of older people retiring to the region that's been a significant issue for the region. So what we, you know, it's not just about how the population grew, it's about what ages that the population grew. So we can have a look at that one, and you'll see within the chart that obviously that significantly changed and moved up. So it may also be linked to employment opportunities that were existing at that time. But I'm quite happy to go back and have a look why we were at that peak there. In relation to the college, more than happy to come back or to come along and do a presentation, have a discussion, because it is important. One of the key things that at the moment people or young people feel the need to leave, but they don't necessarily want to leave, and it's about providing those opportunities to stay. It's not about capturing people. It's not about saying we don't want you to leave. There will always be migration away. It's just that at the moment, migration between 15 and 25 is significant for the region. And one of the things highlighted through the 10,000 Voices research is that people have to leave to seek that those opportunities. So higher and further education is certainly one of those reasons why people leave. And I wanted to just come back to Valerie on the NHS. I should highlight, you know, it's the access. There were many positives, and the report will come through with positives. I'm just on a very sort of short time scale here. So things like, you know, online and telephone GP contacts, you know, the access to services in this new modern way were very beneficial to areas. A place like Les Walt, which has got GP access along with new housing, has seen an absolute positivity of that GP sort of being at the centre of that community, and that really comes through in the reports. So whilst there are negatives when we talk about this, the reports come through with some positives about what's good about the region and what's encouraging people to stay. And I go back to that community sense of community, which is really a strength that's come through.
Thank you. And you know, there's so much good data in here. There's so many potential actions that there's no way we can do this justice. But earlier on, we were looking for themes for meetings. I think this might be quite a good theme to get a bit more, you know, a bit more depth, if that's agreeable to people. But yes, please.
Thanks, Chair. Just briefly, and thanks, Andy, both for the work and the report. I'm looking forward to getting into the detail. I suppose just an interesting reflection that perhaps I hadn't thought about, but back to when the Minister for Public Health visitors before and asked us to almost change our frame and language to about repopulation as opposed to depopulation, and the impact that talking about depopulation all the time has on people who are already here and living here, as much as the people we want to move to the area. And I'm sure it's in the detail, and a bit I'm interested in just any early reflections in terms of community responses about, based on the recommendations, what happens next when Dumfries and Galloway has a repopulation plan as opposed to a tackling depopulation plan, and the impact therefore that has in communities in terms of creating their own spaces to attract people to want to come and live here as well. Thank you.
I'm quite happy to come back in on that one if you like. Just very briefly, just in relation to accepting that the language is the challenge, and I speak about the change in the narrative. At the moment, it is called addressing depopulation because that's the funding that we got from Scottish Government to undertake the work, and therefore that's what it's termed as. And at the work, it is, at present is addressing depopulation. As we look to go forward, and part of obviously the discussions today and further discussion with partners, we will be looking post-April about how we go about repopulating, how we go about changing the demographic and how we go about it. And you're absolutely correct. The changing of the language will come as we move into sort of the next phase. Now we've identified the challenges that exist.
Thank you. We can have perhaps two last observations because I can see people have been waiting, but I would like to give some time at the end to the risk register. So if we can.
Thank you, Chair. Just very quickly, I feel I should comment on it from a housing perspective. Certainly around the language and the community response to new builds, for example, and what that means, and welcoming new blood, new life into the region. I would be looking for the support from colleagues in this forum around that message and in terms of community engagement and how we place that message. I won't speak too much more on that, but I think the suggestion of a thematic future CPP would be excellent, Chair. Thank you.
Thanks, Chair. And just on the back of both those comments, so I think certainly the language, for me, a paper, it's not how many people are here, it's the balance of population. So, and obviously the addressing depopulation was that particular funding stream, but ultimately the issues that it's causing are not so much about how many people are here, it's are there enough people to sustain the region in whatever way that is. So that's the language bit maybe that I'd rather it was less alarmist and more practical. That's my preference, but because then that leads possibly to a more considered discussion rather than a reactive one. But and the housing one is key to that because clearly who's here already, what support do they need? And I've been involved in a part of the campaign that Andy was helpful with, which got excellent reach but mixed feedback, let's say, in terms of like population related issues and attracting people to the region. So so I would certainly say that the housing bit is key, and we're going to fortunately visit some housing later on in Johnson Bridge, which is a new development. But I think if we can get that bit right, and that's maybe for something the Scottish Government could assist with, because it costs more to develop housing here, as you probably know, and sometimes the size of communities is smaller, so it's less bang for buck for big companies. That's a particular rural issue, and I think that's something that we need to kind of address, if that's helpful. Thank you, Chair.
Thank you very much. Stephen, if we can take an action to find some time at a subsequent meeting, because there's a rich vein that will cross across pretty much everything that we've been talking about, so we'd like to give it a bit more depth. Would you like to reflect on the risk registers and things now?
Yep. No, thanks, Chair. No, I'll take that action forward. No problem. Just a couple of areas to prioritise on the business brief. One was the participation in engagement working group, which partners around the table, majority will be represented on, and we had a report from Kirsty Peden, who chairs that group, and it was just to highlight, the concern over consultation fatigue and opportunities being missed to do consultation work at the same time rather than on separate occasions, and maybe doubling up on effort. And it was asked that maybe was just raised to the board just for consideration, and just to try and plan ahead and ensure things are aligned. If any partner is planning consultation work, the community engagement manager would welcome an early chat so she can schedule that in and see if it can be combined with other consultation work going on at the same time, just so we're not treading on each other's toes. So it was just to highlight that was an action that came out of that one. And the risk register, the leadership team took a keen interest in the risk register, and on reflection, it was in recognition of potential threats to funding cuts across the sector, and particularly third sector as well. And at our last meeting, it was felt prudent to potentially increase the risk rating of risks 1 and 3, just due to the increased risk that's possibly imminent on the impact that funding would have on resources, capacity in the ground. And we talked about that earlier on about community planning itself, but it could really have a big impact. So it was felt that it would warrant raising those from 9 to 12. that's what's being proposed and asked for the board to endorse.
I appreciate the board probably isn't comfortable with it, but if it's an accurate reflection and the increase in risk 3, which is really the whole reason for being here and doing it, is a worry. I guess we have to struggle to make sure that the consequences don't happen. Are there any other observations or comments or questions on that?
And just last one, Ben, it was just to note, it's the last item, that there's a new induction resource, national induction resource that's been prepared through the Scottish Community Planning Network. It is a bit of paperwork and background reading, but it was identified earlier in the year when we worked with the Improvement Service that it was a national area of weakness. So various specialist officers have worked together, and it's a new resource. We've put the information in there. And there'll be links to that information as well as a supplement to help with board members' understanding of the kind of broader environment and hopefully make those connections and fill some of those gaps that were previously identified. Thank you.
Okay. Well, I think perhaps against the run of play, we are going to come in on time for our 12:30 finish. Thank you so much for all your contributions and thoughts, and reflecting the fact that in people's busy day jobs, this is a major contribution of time, plus the reading and preparing of papers, which we're incredibly grateful for. So if there are no other things to raise, then we will bring this meeting to a close, and our date of next meeting is in March. So thank you very much, everybody, and have a great weekend. Thank you.